Yaneer Bar-Yam. I am the professor and president at the New England Complex Systems Institute. I do complexity science, and I've been working on pandemics for about 15 years, and on this one's for 6 months.
My name is Anjum, and I teach kindergarten now in Massachusetts. Gina.
My name is Gina Rivera. I teach 3rd and 4th grade math and science enrichment in Gainesville, Florida. This is my 12th year teaching. This is what would start year 12, which is crazy.
Yeah. Rachel?
I'm Rachel, and I was a kindergarten and 1st grade teacher for 10 years, and I have a daughter going into 1st grade.
And Laura?
My name is Laura Warner, and my cat Olive is around here too. I'm a kindergarten teacher in Gainesville, Florida. This will be my 6th year teaching, and I'm also the kindergarten team leader. So I'm trying to get some advice for my coworkers in going back.
Thanks everyone for being here. Our goal is to talk about school reopening because all of us are getting ready to possibly go back to school, and we're feeling a lot of concern about what that might look like in the era of COVID-19. Yaneer, would you start by telling us some of your thoughts around school reopening right now?
You know, it's sometimes we're put into a situation where the framework is not even the right one, or the question is not even the right one. And I think this is such a situation. And it's very hard to address it because there are pressures that are being brought to bear that that are not consistent with, very basic things, right? So, the problem is that we're starting with a very terrible disease, which has horrendous consequences if people get sick. There has been some effort to try to minimize or diminish those things, but honestly, they're not well justified. I can talk about that a little bit more in detail. But the short story is a lot of people get sick, very sick, are in hospitals for a long time. Many of them die. And the harm that the disease causes, even for those who recover, is not well understood. We already have a substantial amount of information that that there are significant long-term consequences. And one of the narratives that's been going around is that it's only old people and all of this stuff, and that's totally not true. So, I hear, the statement, open up schools, and it doesn't go in, it doesn't fit with what's happening in the world. So that's kind of where I start. I can't start with the conversation as framed. I have to start in a different place. There was one good piece of news recently, which is that both LA and San Diego shut down their schools for the fall semester. And given the tremendous pressures that are on them to open up, the fact that they didn't is a sure and present sign of the fact that it's totally unreasonable to even consider it. Now, I can go into some more of the details. I just took an opportunity recently, late last week, to go through the kind of current information about schools, about teachers at schools, and about the risk of both transmission and severity of disease. And so I can tell you about that if that's what you want to hear for clarity.
That would be great. One of the things we've been hearing is that kids are less likely to catch COVID or have severe symptoms, and that they're less likely to spread it. And so if you could speak more.
Really interesting word, less likely. So I would have to say that all of those statements are true, but they miss the point. It's like, let's say there are, 95% of people, I just give an example, 95% of people who die if they drop out of a second-story building or something like that. And then you say, well, kids are less likely to die. And it turns out that that percentage is 93%. I mean,
Right.
is that?
Relative to the original? Yeah.
That's right. It says less, right? So that's less. So it turns out that kids at different ages, as far as we know, with the best available data, are less likely to get sick. And it varies whether you're talking about kids of school age. We can look at the numbers. So here's part of the issue, and I'll tell you, let's say people tend to make statements based upon kind of pieces of information rather than the whole of information. Let me try to do this. So, as an example, children aged 0 to 14 were 34% as susceptible to the virus as adults aged 15 to 64. That means 1/3 as many kids got infected as adults. Now, 1/3 as much is surely not zero. And the other part of it is, it doesn't actually tell you what will happen if you just keep going, right? Because all that says is that if we had a small percentage of the population infected, then you had a smaller proportion of children. But if you let it go, then why would it ever stop infecting people? Right. So at that point, you're saying that basically everyone's going to get infected. And that data is not even relevant to that question.
And then do you also wonder, are they just getting infected less because they have been at home more? Like, we did shut down schools, and so they didn't have I know my children have not been out of the house except in our yard for 6 months. So,
And very young children, in fact, like 0 to 6, they're indeed less likely to get infected according to the study. But if you think about it, kids age 0 to 3, they're not likely to be exposed to anybody except for their parents.
mm-hmm.
So the whole data stuff is very unreliable. The other thing is, how severe is it? So the data that the CDC provides, and this is maybe a little bit better idea. The number of severe cases among children compared to the number of severe cases among adults is about a factor, is not quite a factor of 2. So that means that something like, let me just give you the number, 20%, it says, well, there are 2 different numbers. One is 10% of adults, and the other one is 33% of adults, depending upon how we count them. So let's say we take a number like 20%. So 1 in 5 adults get sick. And something like 1 in 10 of kids get sick enough that they have to be in a hospital. Is that a small number? Doesn't seem to me to be a small number. I mean, being in the hospital means you're very sick. And the doctors say that people who have this disease are really very badly sick. So I don't know any parent that would say, I'm going to send my kids to school with a 1 in 10 chance that they'll end up in the hospital. I mean, I wouldn't think so.
No, or a class of 20 kids, that would be 2 out of the 20.
A lot of the 20 are going to be in the hospital, gasping for life. Doesn't sound to me like the right framework at all. So the question is, I think the question that I struggle with is, given that those are the real numbers, why are people even talking about this? Because it surely doesn't make sense to me. I mean, let's put it this way. Before this disease, parents would be worried about their kids walking to the corner to take a bus by themselves. And now they're going to send their kids to a place where 1 in 10 times they're going to end up in a hospital. It just doesn't make any sense to me.
I also think that it doesn't make sense that if we take it back to March 13th, March 14th, around the time that we decided to close, Gainesville was an area that was lucky in the fact that we had very little numbers. And at that point, nobody hospitalized. And we decided that the safest route would be to shut down for those last 9 weeks of schooling. So I don't understand the logic of us having the spread we have now and calling it moderate, which is what they're calling it for right now, at a 4.3% spread, and saying, no, it's going to be fine. We're going to put measures in there and it's going to be fine. And today, the union president, Carmen Ward, had a chance to speak to our local health department leader, or the person who oversees, person in charge, and they said that they wouldn't suggest schools closing until that percent of spread was at 10%. And so to me, thinking that we have to more than double the spread before they consider shutting down schools is ludicrous. And the conversation, I feel, and I don't know if my fellow teachers will agree, but I feel like this entire conversation on whether or not we should reopen schools has been centered around the children, which I understand. The children are the biggest number that we serve in a school, right? That's the whole point. But children are not going there to be taught by robots. They're going over there around adults of different ages, adults with different immunities, adults with different conditions, adults that are cancer survivors, adults that are in immunosuppressants, adults who are over 65. So if they're not going over there to be taught by a computer, there's going to be a person in charge. And the younger they are, you guys are kindergarten teachers, you know that the probability of a student following all these orders that they're putting, it's ridiculous. I teach 3rd and 4th graders, and 2 of my 3rd graders suck their thumbs in class. And these are 8-year-olds and 9-year-olds. So we have been put in this bubble of, well, you guys are being selfish, when it's not the case. I myself take care of an elderly person at the home. I have a toddler and my husband is diabetic. So that's already a threefer. And the fear that I have going back to brick and mortar, I feel like it's not being heard. It's not even being considered. So that's where I stand. I'm very much against opening schools up.
Rachel, do you want to say your thoughts?
Yeah, I feel the same way, and but I also understand that parents need childcare so that they can go to work. So I feel like the pressure is on the schools to solve the problem instead of it being put on the businesses in the economy, or however you want to phrase it, like putting the pressure on that side to what do we have to do to keep the kids home from school, to keep them safe? What does your business need to do to help the parents be able to work from home or have a more flexible schedule or something like that? I know, like my employer, I'm trying to go through HR to see if I would be allowed to continue working from home if the schools are open. And that, I want to keep her home. I want to do my job at home, but they might not approve it. So.
Laura, what about you?
Yeah, I definitely agree with both Rachel and Gina. I think it's just very stressful to imagine all of the learning techniques and collaboration and sharing supplies, all of the things that we do in a classroom naturally, and then try to say we're going to go back and kids can't touch each other and we can't touch them. I mean, as soon as a kid sees another kid, they like want to hug or hold their hand. Like that's just part of how we socialize and what we've, you know, taught kids and taught each other as teachers, as a community, of how to work together and how to learn. So I think part of my main frustration is trying to figure out what schools are supposed to look like going back and what actual precautions need to be taken. You know, so we've got a lot of vague plans, but no actual, here, this will make it safe and healthy for everyone. And that's really not seeming realistic. So that's where my confusion is coming in.
Agree.
It's because a lot of the people who are making those decisions haven't been in a classroom in a long time. Even just the setup of kindergarten, you don't have desks, individual desks for kids. They all sit at shared tables facing each other. And so are you going to get all new furniture? Like, probably not.
The building blocks of primary education, where we sit together and we sing songs and we share stories together, are just really challenging to reimagine in a socially distanced space.
Let me make it a little bit harder. Even the guidelines that they give are not nearly adequate enough. We're facing with this challenge where the people who have made those decisions clearly decided what the right answer was before they asked whether this was going to be safe. And that's very difficult to cope with, right? What do we do? Just to drive this home, it's been tried. You know, people have tried sending kids back to schools, and there have been major outbreaks. You know, Israel sent kids back to school, and they're now suffering from a huge outbreak. They now have, in the last case, 2,000 cases yesterday. And in Europe, there were a number of very big outbreaks in time when they initially sent kids back to schools. Now, they are actually taking very strong precautions. And one of the things that they're doing is they're selectively relaxing restrictions in areas that have much fewer cases. Right? So rather than, I mean, Florida has way more cases than any of the places in Europe, any of them. And any effort to try to compare opening up schools in a place where there are that many cases and a place where there are few cases doesn't make any sense.
It's apples to oranges.
That's right. It's totally different. So we have this situation where there's this very manifest reality, which is inconsistent with what we're being told to do if there's any desire to achieve safety. And that creates very big challenge, which is really, how do we deal with it? I mean, let me just say that if one really wanted to try to figure out a way to make things safe, you would really have to have everything only outdoors. You would have to have separated spaces for kids that are likely to go in contact. You would have to have separated spaces for each of the children, but you wouldn't be able to go up and touch them. And what would you do about bathrooms? Right? Shared bathrooms are known as a vector of transmission. And how are you going to have a school with either enough bathrooms or cleaning a bathroom after every time someone is in there? It's really not possible.
So I think that's the major issue that I feel. It's like they're kind of putting in a smoke screen of, look at all these things we're going to attempt to do to make it safe. But any person who uses reason and has actually paid attention to people speaking on science and fact, and people who are actually experts in the field, tell us that those things are not going to work, or it's not enough. So it almost feels like this has turned more into a political thing more than what is actually accurate.
Right. So there's to put it in a very direct way, there is a failure of leadership, a failure of governance. Because one of the main role of leadership ultimately is to represent and to serve the people so that the people are safe, right? That's what it's supposed to be all about. So we've shifted now from a conversation about schools to a conversation about systemic failure of the societal leadership. And you know, if someone tells you to shoot yourself, you know, I mean, that's not a good thing. And right now we're kind of in that situation where they're basically telling everybody to play Russian roulette, which doesn't make any sense. So here's the question: what do you want to do about it?
I have emailed the superintendent at least 3 times. I have emailed the board of Alachua County several times. I have emailed my principal, so my administrators. I've been talking to my team, trying to give them reasoning, background, CDC guidelines. I mean, I'm trying to go at it with fact, but I haven't reached an answer that tells me anything but we will try to make it as safe as possible. And I tuned into the 7-hour board meeting that we had last week in our county. They took, not only the board members expressed their concerns and opinions, but they also allowed people to call in. And I thought it was very interesting that it was about reopening schools, but the whole thing was done through Zoom. So the board members don't want to meet together in the same room. But we're talking about putting everybody else in. So that within itself was hello. But after that 7-hour meeting, it seemed like most of the people who called were people who were concerned about the same things that we were. And I feel like the community, that is parents, probably have more of a voice in this, with these decisions than the staff actually does. Mm-hmm. So but we have parents in the community that are screaming for schools to reopen, and not just parents that are essential workers or parents that have 2 working parents or a single parent who has to have somewhere to send their child. There's also people who are being very candid about the fact that they cannot teach their own children, that they're ready for normalcy. And I keep trying to tell them normalcy is not what you are going to get in a school setting. It'll be very far from normal. So they're hanging on to that. American Association of Pediatrics that said that it's better for a child to be at school than it is to be at home. And I feel like it's being taken out of context because that's not what that decision was based on. They said in
that back.
Exactly. They actually had to re-explain what they meant by that. They said under safe conditions, it is safer for a child to be at school than to be at home under safe conditions. But these are not safe conditions, but people are hanging on to the narrative that, oh, but the doctors want them to come back. And that was not the point. So I get very frustrated when people catch on to the wrong point and still have my life in danger, a child's life in danger at school. Like they don't see it. Sorry.
Yeah. Laura, what do you say?
I mean, I agree with all of those concerns. One of the main things that I think is not really being addressed is, I guess there are numbers to support that kids are not as likely to get COVID, but is there any information or data about kids spreading it? You know, like kids come to school, then do they go to a daycare? Then they're interacting with all those people, then they go home. Then where have the parents been? I feel like it's really gonna be a major way to spread this around a lot.
Again, it's hard for us to separate. It's hard to document where exactly the spreading happens. Right. But we know that opening schools has had a dramatic effect in a number of places, and that there have been these super spreader events that have happened. And there have been a few school systems or places where they've opened up daycare, and they've just 2 days later they've said we can't do this, or, you know, it doesn't work. So here's kind of a few statements that I would make. Number one, we're still a fair time away from schools opening, at least if they're on a regular schedule. How far are you away from schools opening?
August 10th is Florida. So
So that's, what is it, 3 weeks?
Mhm.
The one
And
thing
you
that I
go
would
back
say,
earlier than that.
you do, yeah.
Right? Teachers go back at least a week before to start preparations. So they'd be back at the beginning of August.
All right. So here's, here's my main recommendations. I think you have to organize people. Reach out to the people. Don't fight to get people that don't agree with you. First of all, start by organizing the people who agree with you. There are a lot of those. And galvanize their collective action and expression of the challenges of what's happening, that it's not going to work. And it'll take some information gathering, but we have that information. But the main thing is that the reason that things should be done is because people will get together and agree to do something about it. So there are two levels at which I would recommend that things be done. First of all, at the level of challenging the opening of schools. And I think that you won't be alone. I think there'll be a lot of people that will be. I put in the chat the link to this piece that I put together. There's a Twitter stream that I put out last week that has some more of the stuff in it, and there's some more recent stuff. So if you look at, I'll find it. So the point is, by yourselves, as you find out, your voice is not necessarily, not clearly not going to be enough. But the question is, at what point will a group of people getting together be able to influence decisions? You may not be able to influence everybody, but we need to find that point. So that's number one. Number two, I would not just organize around the not opening up schools, but I would recommend that you organize around changing what's happening about combating the virus. And this is basically what I'm doing here. So my short comment is, I don't want you guys to risk your lives. And I hate to say it, but that's what's happening. Your lives, the lives of your students, your parents, your friends, your relatives. Surely that's not a good thing. Now, what is the strategy? Again, the strategy is to galvanize the people that are around you. We are 5. We need to become 50, 500, and so on. And the way to do that is to yourself invite people, find out who wants to participate in this, and then for them to find more people and to keep going. And it's not easy work. Organizing people is hard. But this is essential. The second thing is, as I said, to focus on changing the response effort. And I don't know how much we want to go into this today, but none of this had to happen. We didn't have to have the virus. We could have gotten rid of it at any time in the last 6 months, just by doing a few important actions. And it's really that's which I've been saying since January. And those actions are not much harder than what was done before in terms of the quote lockdowns that people did. It's just that they did them in a kind of half-assed way, if you'll excuse my expression. So the challenge right now is that because people did it in a poor way before, they don't think that anything will help.
Mhm.
And what we need to do is to show people and explain to people that if they do it the right way, that not only can we decrease the virus, we can actually get rid of it completely. And we have the situation in the Northeast where it has decreased, and the opportunity is there for us to keep going and get to zero. But again, in the Northeast, like in the South and West, something is stopping people from saying, okay, why don't we just get rid of this? And I think a lot of it just has to do with the kind of narrative that people have said that, oh, it's just going to come back in the fall, there are going to be these waves and so on. So why should you fight something if it's anyway going to come back? Which isn't true. Countries can get rid of it. Some countries have gotten rid of it completely. If the disease is not present, then it doesn't propagate. So there's this fundamental statement, which is that 0 times any number is still 0. The point is that that's very different from 3 or 5 or 500 or 50,000. So people have to really focus on getting actually to 0. And understanding that is super important. Understanding how to do it is important. And the even more important thing is to get people to agree to do it together.
So if I may ask you a question, here in Gainesville, we have a unique thing, or at least unique to university towns, that we have a major college here, the University of Florida. The University of Florida can have upwards to 50,000 students if they are all here. Now, some students will be taking classes just online. My brother is an engineering student, and he got to have a schedule where all of his 5 classes are going to be offered online. So he's not going to be engaged. So he actually flew home to Puerto Rico, where things are not doing well either, but he thought he'd just go home. So we have the situation that the campus is set to reopen so far, and that some classes didn't have a choice on whether or not they were going to be live or online, so they will be live. So what happens in this town where the number is increasing when you have these students coming from different hot zones in Florida, including Miami, including Palm Beach, including Jacksonville, including Tampa, including Orlando, and you bring those people here, where our hospital is already at 80% capacity without all these students joining in. You know, I don't understand why we're not seeing that as a factor of how that's going to affect our population.
80% capacity is going to get hugely worse over the next couple of days, right?
I'm sure.
And it's going to accelerate.
Yeah, there's 2 things that they're hoping to do in this special board meeting that they have scheduled for July 15th, which people had to demand for this special meeting, and luckily it did go through. They're going to vote on 2 things tomorrow, and that is on whether they mandate that the students must wear masks, because as of right now, it is not a mandate. It is suggested, like strongly encouraged, but it's not mandated, which means a parent can easily say, we're not going to have our child put a mask on. Not that they're going to keep it on all day. Kindergarten teachers know what I'm talking about. And they're going to vote on that, on mandating them. And then the other thing they're going to vote on is pushing the school year to start at the end of August 29th through the 31st at some point. I believe that would maybe be better because it would give us a chance, sounds horrible, but those trends to keep rising so they can see this is not going to get any better. So that's what I'm hoping happens, but.
Yeah. So I think that all of that is right. And you should do that. You should organize people again, get more people, contact parents, ask them how they're doing, and and get the people who feel that this is not right to support each other.
Sure.
Okay, that's super important. And then when we have more people, I would like to talk with them about the alternative. And the alternative, and having the university there would be a big help if they got on board too, is to take strong actions that would go the other way, to have the cases decrease and getting to zero. And honestly, if we started this today and we had people on board, we could open up schools probably not September 1, but probably October 1 without any risk.
Okay.
It's that fast. It's basically about 5-6 weeks. At this point, with how bad it is there, it might take another couple.
And that would be a strict lockdown.
It would be a strict lockdown. There would be some other pieces that people don't know about and are not aware of. It would be isolating people away from home so they don't infect their families.
Mhm.
It doesn't have to be everybody, right? Not everyone can do that. There are reasons they can. But, you know, most people away from home is a big help because otherwise they infect their families. It would actually include a different kind of testing, ideally, because this would accelerate things a lot. Instead of using the PCR testing, we would use CT scans because they're so much clearer, they give better information, and they give the information immediately. So instead of waiting a week, you wait 5 minutes and you have the results back. So that's another piece of it. And overall, there are these other strategic things which are like, so if Gainesville decided to go to green, or even a neighborhood decided to go to this strategy, we would want to protect it from other people coming in. Like you said, you don't want all these students coming into the university. So there's what we call a green zone strategy, which is basically you protect boundaries. You won't let people in unless you do 14-day quarantines and all other appropriate things. And that's necessary. So there is this set of strategies, including social distancing, lockdowns, masks. There's this testing strategy that is the one everyone knows, but is much more effective if you use CT scans. And then there's the travel restrictions. And then there are a few other things like making sure essential services are safe and making sure that vulnerable institutions are safe. It's not a long list, but it's the right set of things in order to stop the outbreak. And if one does them, then, you know, within a few weeks, it's gone. Because the difference between going up exponentially and going down exponentially is doing these actions. Once you're going down exponentially, then it goes to zero as fast as it went up.
And we could have done all that in March or April.
We could have done it all at any point in time. And the sooner we did it, the less we suffer. But the problem is that there is this cacophony of voices. And now we have to figure out how to create local efforts that will manifest this. Because it's happened in other places in the world. There's plenty of demonstration cases. But right now, what we need is to do it here in this country. And we're working on several examples in different places around the United States. I have another call with Arizona in an hour and a quarter with a county person. We're really trying to push it in many different places, and hopefully that will make a big difference.
So to serve as a model and then say, look, this area did these things and they are down to zero. Let's scale it up.
That's right. And again, the main thing, and there's no secret about, you know, sort of what this requires. It really requires a significant, you know, buy-in from the community. It doesn't have to be everyone, but it does have to be a significant set of people. And the fact that people are worried about sending their kids to school may actually be, if you will, an opportunity to galvanize them to take action. Because otherwise, they're going to be in very bad trouble. And maybe not everyone realizes that, but a lot of people do. So what would be helpful? There's a lot in principle that we might talk about specifics, but what would be the most helpful at this time?
I guess talking to people like our superintendent, Karen Clark. So she has a direct line of communication with someone who studies this, is what I
Talk
would
with
say.
her. You know, if you can arrange, I mean, I don't know her. I mean, I don't mind, you know, contacting her if you give me her phone number. But, you know, the bottom line is find a way to make the contact. I'll be happy to have that conversation. And I'll be happy to talk with other people who are in the community, whether it's, you know, the nominal leadership or whether it's the, you know, the parents or the other teachers. Um, I'm not sure that I'm as good in talking with the kindergartners, but I'll be happy to engage with anyone you think will be helpful.
Okay. I can get that information to Anjum, and if you want to serve as their liaison. Like,
One of the problems that I feel is happening is that teachers and a lot of parents I know are on board. It's not a good idea for kids to go back to school given the way that things look right now. And then coming from above is this view of we're going back to school and we're going to find a way no matter what. And I feel like we're just clashing. And I don't know how to get past that point of very differing points of view.
I think the first answer is to organize. You just have to, the point is it's very different for people to have this view. And if they join together and express it together, that's going to be a very different statement.
power in numbers.
Right? And people have to understand not only that they feel this way, but that other people feel this way, because everyone has, you know, these questions. Do other people agree with me or not? And if they come together and they recognize that many of them, not necessarily all of them, but many of them feel this way, then it changes their opportunity for action.
I think just hearing that there is something that can be done, like, gives me hope and gives me, you know, because I was feeling like it's kind of hopeless. We have to deal with it. Like, we're going to have to find ways to just lower the risk. But if there's a way to stop it, then let's do that.
Yeah.
Yeah, that's the point. And eventually, actually, I'm pretty convinced that everyone will realize that. The problem is that we want to do it as soon as possible. We don't want to pay the incredible price, which is both of people and for those people who are, you know, thinking otherwise, they won't understand, but they will eventually learn that they made the wrong choice, even for the economic cost reasons that they thought were the purpose of this. There is no benefit there, none.
This has been very informative for me. I think I feel like I have marching orders of kind of spreading this information as much as possible. I'm a member of a couple of Facebook groups of people that are organizing to talk about opening schools. So I'd be happy to share all this with them so that we can have more numbers, like you said, to get more organized. There's a very dedicated group of parents right now going against the board on opening. So I think we need to keep, to use your word, galvanizing them, because it seems like they have the spark. We just need to keep throwing more wood into that fire.
That's right. And again, if you want to let them know that I'm available, if they would like to talk with me,
Sure.
and share their concerns, and I'll share. Again, the main thing I can share is that there is this other path, the path to not only opening schools, but opening schools safely. And to
Okay.
really having that opportunity to go back to what should be the normal life that we should be living, and not this fear and reality of of harm.
Yes, sir.
Thank you so much for these great action steps. I know, just like Rachel said, I've felt pretty powerless in my position as a teacher to affect change in the school system because there are so many pieces outside of me and my school telling us what we need to do. So I'm grateful that there is a path forward.
Okay. So great to talk with you, and let me know if you have specific questions, if you have other people, and here's the thing, time is of essence, you know that. So if you were to tell me, hey, I spoke with all these people, they'd like to get together tomorrow, the next day, whatever it is, we'll find a time.